Hello friends, welcome to Creative Medicine. In this lecture, we will learn about knee joint is an example of diarthrosis. So there are mainly three types of joints. Three types of joints. Joints are of three types. One we have synarthrosis, second we have diarthrosis, third we have amphiarthrosis. Synarthrosis are immovable joints and they are fibrous joints. Amphiarthrosis are slightly movable joints and they are cartilaginous joints. Whereas diarthrosis are freely movable joints and they are synovial joints. So in knee joint is a synovial joint, so that is diarthrosis. The joint between the epiphysis and diaphysis of the bone is the joint between the epiphysis and diaphysis between the bone is synchondrosis. Epiphyseal-diaphyseal joint is synchondrosis. It is mainly found in the bone where growth plate connects the epiphysis with the diaphysis. There will be an epiphysis and diaphysis connected by the growth plate. This growth plate is actually a hyaline cartilage. So this type of synchondrosis is called as hyaline cartilaginous joint. Innervated structures of the joints are all except. So sorry, I did not get the options. Actually, innervated structure of the joint are, there is no innervation, that is no neurovascular bundle in articular cartilage. So important thing is articular cartilage is devoid of any neurovascular bundles. Next. Ear ossicles articulate with each other with which type of joints? Ear ossicles will articulate with each other with synovial joints. That is, in the ear ossicles, we have two ear ossicles, malleus and incus joint, and we have stapes and incus and stapes joint. Malleus and incus joint is a saddle synovial joint, whereas incus and stapes joint is a ball and socket synovial joint. Median atlantoaxial joint is a synovial joint. Which type of synovial joint is it? It is a pivot type of synovial joint is median atlantoaxial joint. Intracapsular articular disc is present in. Intracapsular articular disc is present in some joints like sternoclavicular joint and temporomandibular joint. You see intracapsular articular disc. So joints like sternoclavicular joint and temporomandibular joint has an articular disc between them. What kind of joint is syndesmosis? Syndesmosis is actually the fibrous joints which are again of three types. The fibrous joints can be sutures, they can be gomphoses, and they can be syndesmosis. So syndesmosis are a type of fibrous joints. So fibrous joints, the other two types are sutures and gomphoses. Vomer, ala and sphenoid rostral junction is the joint between vomer ala and sphenoid rostrum junction is called as scindylosis. We call it as scindylosis. So what is scindylosis? Sphenovomerine joint is a scindylosis suture at the roof of the nasal cavity. Pubic symphysis is which type of joint? Pubic symphysis is a cartilaginous joint. Actually, it is a secondary cartilaginous joint which is slightly mobile. What joint is the growth plate? The growth plate is a primary cartilaginous joint is the growth plate. So growing bones have epiphyseal growth plate between the epiphysis and diaphysis. So this epiphysio-diaphyseal joint is primary cartilaginous joint, or it is called as synchondrosis. Manubriosternal joint is the joint between manubrium and sternum is secondary cartilaginous joint. Manubriosternal joint is symphysis or secondary cartilaginous joint. Inferior tibiofibular joint is inferior tibiofibular joint is actually a type of syndesmosis is inferior tibiofibular joint. The type of joint between the sacrum and coccyx is actually a symphysis, which is a secondary cartilaginous joint. So it is symphysis. Sacrococcygeal joint is a secondary cartilaginous joint or symphysis. Which of the following is compound condylar joint? Compound condylar joint is actually the knee joint. Knee joint is compound condylar joint. Which of the following is synovial joint of condylar variety? Synovial joint of condylar variety is, example, we have metacarpophalangeal joint is a synovial joint of condylar variety. Metacarpophalangeal joint is a synovial joint of condylar variety. But these are actually functionally ellipsoid joints. Metaphyseal joint more than radiocarpal joint is the condylar variety of synovial joint. Which of the following types of joints are present between malleus and incus? In malleus and incus, we have saddle type of synovial joint is present between malleus and incus. Atlantoaxial joint is a synovial variety of atlanto-occipital joint is an ellipsoid joint. If ellipsoid joint is not there in the options, then it can also be called as condylar joint. So functionally, the atlanto-occipital joint is ellipsoid joint functionally, but structurally it is condylar joint. Functionally it is ellipsoid joint and structurally it is condylar joint. Thank you, and thank you for watching.